Hi folks, and good afternoon. I'm Neil Barton. Thank you very much this afternoon for joining us for this KTK News and Fox 51 report. Here now we're having a joint news conference between the Smith County officials and City of Tyler. Let's go to that right now.
District, we're going to take some time in the midst of this pandemic to reemphasize the importance of staying diligent in the weeks to come and the months ahead. It is imperative that we continue to make good individual choices and reinforce healthy habits that we have established as a community these past few weeks. In all that is said and done, I want to be sure that all members of our public hear me say some very important things to me. First, each life in our community has equal and eternal value. Each person has been called for a specific purpose in this life, and allowing a life with purpose to meet an untimely end because of the coronavirus is simply unacceptable to me as your county judge. You're going to hear and get lots of updated health information today, and we will answer a number of questions at the end of this briefing from the press corps that's in attendance about the status of the matters. But let's not lose perspective about what is really important through all of this: preserving life and restoring liberty. Before I go any further with my remarks, let me introduce those who are with me today. First, you know Mayor Martin Hines, who has been with us each week during these briefings from the City of Tyler, and also the City of Tyler City Manager Ed Broussard. We have George Roberts, the CEO of Northeast Texas Public Health District, Dr. Jeff Levine, who is our local public health authority here, and then a special guest for today, Reverend Ralph Caraway Sr., who is the pastor at St. Louis Baptist Church here in Tyler, Texas, and Nancy Rangel, who is the executive director of the Hispanic Business Alliance. As been our custom for the past few weeks, we're going to each have a few minutes to present a few bits of information, and then we're going to take some questions and provide some answers at the end of this briefing from the press corps that's in attendance. Thanks again to Tracy Walker, who is providing our sign language interpretive services for those in the deaf and hard of hearing community here in Smith County and beyond. Before I release the microphone to our other speakers today, I want to talk about three important concepts that will frame many of our discussions and decisions in the weeks and months ahead. First, the concept of discipline and diligence. Second, the concept of healthy choices. And third, the concept of a responsible restart. This first concept of discipline and diligence. These ideals must overwhelm and dominate any temptation to become complacent and careless in our daily lives once government regulation is listed. Behind me on the screen, you're going to see a regression analysis in a chart that visually communicates a 3-day rolling average of new known COVID-19 cases here in Smith County. A little bit later, Dr. Levine is going to talk in more detail about this particular graph, but as a starting point, I want to point out that although this graph shows a downward trend in the growth of new cases here in Smith County, which is very encouraging, we do not want to be complacent during this time frame. We don't want this interim trend to lull us into a false sense of security. If we are not careful and if we do not exercise personal discipline and remain diligent in the way that we interact with one another, we can easily see this trend reverse. A resurgence could occur overnight if we become lax in our personal and commercial lives, so let's don't do that. Let's don't get complacent. Let's be disciplined and let's be diligent in every facet of our lives. Let's do this so that when we get back to work in the coming weeks, in the words of my friend Jay Ferguson, we can get back to better. Second, let's talk about healthy choices. There's another graphic on the screen that's going to illustrate some of what I'm going to talk to. As regulatory constraints are lifted by the end of this month at the local and state level, remember what we have learned during the last month. Social distancing and the exercise of cautious, healthy habits does make a difference. But these are health choices that individuals and businesses will need to continue voluntarily as we move forward. If we do not do that moving forward, the progress we have made to date will be of little consequence. These healthy choices will be the difference makers moving forward, so you will hear this message from me and others over and over again. Continue to wash your hands frequently and at least 20 seconds. Keep your distance, avoid crowds, and stay at home if you are sick. Continue these practices even if you have the liberty in the future to do otherwise. Remember that with freedom comes responsibility. And my belief is that the citizens in Smith County will be the example across the state as to how to work, play, and live responsibly in this new paradigm and with these adapted social norms. I'm certain that this community will embrace these responsibilities with due seriousness. So continue healthy choices as we come out of this societal pause. Third, let me talk about a responsible restart. Let me address what to expect from a regulatory standpoint locally moving forward. What you will see from us here in Smith County in coordination with the City of Tyler through our joint EOC operations is what we have termed, in fact, a responsible restart. Remember that when we entered into this regulatory time period locally, we did so in a prudent and reasoned manner. And I can assure you that we will exit the same way. Our decisions will not be emotionally driven, but will be made with rational forethought and with purpose. Currently, we are awaiting Governor Abbott's remarks at the end of this week about what he intends to do on the statewide level. As you know, he has a statewide stay-at-home order until the end of this month. We anticipate and expect that tomorrow he's going to provide additional guidance about what he intends to do on the state level. Our hope is that he will allow each community to decide what is best for them. Smith County is different from the rest of the state, and we need the flexibility here to make our own decisions. But we will have to wait and see what the governor ultimately does tomorrow on a state level before talking specifics about our responsible restart plan next week. Know, however, that we have already been focused on the restart issue in the EOC for some time now, and we are ready to move forward when given that opportunity. If given the flexibility on the local level, our responsible restart initiative will certainly have 4 tenets, at least. First, we will emphasize what we've been talking about here today and previously about the need to continue good, voluntary, healthy habits and personal choices in our individual lives. Second, we're going to focus on ways to provide support for our businesses locally. Third, we will phase out some of the local stay-at-home order provisions and eliminate some of those provisions altogether in a prudent manner while continuing to protect the most vulnerable in our community for a near term. Fourth, we will identify and propagate best practices for businesses to voluntarily adopt moving forward for a period of time until we are further distanced from the effects of the COVID-19 pandemic. This is really the framework of what you should expect us to talk about in the weeks coming as we move out of a regulatory time period and into a period of more freedom and independence as individuals and businesses. I recognize that our community needs to get back to work and wants to get back to work. Be assured we want that to happen as well, but it must happen in a responsible manner. Stay tuned next week for more details once we hear from the governor and know what liberty he is providing to us on the local level and what he is going to do statewide. Okay, now let me turn the microphone over to George Roberts, CEO of the Northeast Texas Public Health District, to provide a community health update. He will be followed by Dr. Jeff Levine to discuss activities of the Public Health Lab of East Texas, and then he will be followed by our special guests, Reverend Caraway, Nancy Rangel, with conclusion by Mayor Martin Hines. Thank you again for joining us today, and we wish you the best and hope that you and your family are staying safe during this time. George?
Good afternoon, everyone. Thank you, Judge Moran. Again, I'm George Roberts with the Northeast Texas Public Health District. Welcome. First, let me share our updated case dashboard for today for Smith County for Thursday, April 16, 2020. You'll see there behind me. In Smith County, we now have 112 Smith County confirmed cases, an increase of 4 since yesterday. Our recovered patient count is now 47, and we will update that number tomorrow, which is Friday. There are currently 51 East Texas patients in Tyler, Texas hospitals. Next, I would like to share with you a graph which shows the positive cases in Smith County based on the day that their lab test sample was collected. You see that on the screen right there? Okay. Thank you, Judge. Let's go back, go forward more. That's the heat map. One more. There we go. There's one. Thank you. So this again, this shows the positive cases in Smith County based on the day that the lab sample was collected. As you will note, the curve is beginning to flatten. Look at this over here. You see things starting to flatten there. You'll note on this graph several dates in particular. First, you'll note March 13th, which is the date of that the state of Texas did a disaster declaration. Next, March 16th, that's the date the Smith County declared it was disaster declaration. March 20th, the City of Tyler disaster declaration was enacted, and on March 27th, the Smith County stay-at-home order was issued. As you look at this graph, please remember that once an individual is exposed to COVID-19, it takes 2 to 14 days from the date of exposure to develop symptoms and be considered for testing. More than half of the individuals develop symptoms by the 5th day. Please note in the last 7 days how the number of positive cases has begun to decline on a daily basis. The next item I want to show you is a zip code map. Thank you. So you'll see there it's a zip code map of positive cases in our region. You can see from the concentration of our cases that primarily the more populated areas, zip codes in Tyler and Longview are the ones that have the most cases. You can see, obviously, Tyler right in here, as well as Longview over here.
Place in calculated areas, zip codes in Tyler.
In many ways, in deference to my friend, Reverend Ralph Carraway, I feel like a preacher that's been up here sharing a message with you, which is this. We don't want you to get the coronavirus. Again, we don't want you to get the coronavirus. Every speaker, every time we have talked up here, anything that we've talked about is all about we don't want you to contract this virus. I've discussed many public health prevention measures, and I'll repeat those momentarily. But recently a question has been asked, what are the at-risk communities? Well, we've known from the start that individuals most at risk for more severe complications from COVID-19 are individuals over the age of 65 and those with chronic medical conditions. In the CDC's MMWR periodical dated April 10, 2020, it was noted that almost 90% of hospitalized patients have some kind of underlying condition. Of these, almost 50% had hypertension. Almost 50% were obese. Almost 35% had chronic lung disease. Almost 30% had diabetes. And 50% of those 65 and older had cardiovascular disease. These findings underscore the importance of the preventive health measures that we've discussed many times over the last month, which include social distancing, staying 6 feet away from your neighbors, staying home when you're sick, staying home in general, except to go out for essential services, washing your hands often for 20 seconds, covering your cough or sneeze in the crook of your arm, and finally, cleaning and disinfecting your surfaces. These measures are crucial to protect older adults and persons with underlying medical conditions. Another chart that I want to show you here is another question we've asked recently is about racial ethnic data. Here we go. So in Smith County, for those patients who have tested positive for which we have data, 60% are white, 26% are African American, 3% are Hispanic, and 9% are Asian. Now, let me speak briefly about the health of Northeast Texas. In the University of Texas Health Science Center study titled The Health Status of Northeast Texas 2016, an overview showed that for Northeast Texas, for the 5 leading causes of death in the United States, heart disease, cancer, stroke, chronic lower respiratory diseases, and unintentional injury, Northeast Texas experienced higher incidences of mortality. In fact, the study noted that if Northeast Texas were its own state, it would rank 49th in heart disease mortality, 47th in chronic lower respiratory disease mortality, and 51st in stroke mortality. At that time, one of the major determinants of this was determined to be tobacco use. In 2014, nearly 25% of adults in Northeast Texas were smokers compared to 15% in Texas overall. Now, why do I share this 2016 study with you? I share it because you've heard this before in many cases, but I also want to focus attention on this report along with the information that I just discussed, stating that 90% of hospitalizations for COVID-19 involved underlying conditions or comorbidities such as hypertension, obesity, chronic lung disease, diabetes, and cardiovascular disease. Given the burden of these chronic diseases in our community, we want to make sure that each person is taking all the steps they can do to limit the spread of COVID-19. Because like I said at the beginning of our remarks, we don't want you to get coronavirus. Now, let me invite Dr. Jeff Levine, who's the Smith County Health Authority, up here to give a few remarks. Dr. Levine.
Good afternoon. Thank you, Judge Moran, Mayor Hines, and Mr. Roberts for the opportunity to come and visit today on a couple of subjects that I want to update you on. First, I want to talk a little bit about the progress of testing in the region, particularly as it relates to the Flat Lab. And secondly, a little bit about this notion of flattening a curve and what do we mean, and recognizing that we're not always talking about the same curve. So we adopt that kind of language because we hear it repeated so often, but I think it helps for individuals to understand what curves we're actually flattening in this process. So first to testing, as you know from previous press conferences, the FLET, the Public Health Lab of East Texas, resumed receiving samples for testing on Monday, April 6th. By the close of operation yesterday, April 15, and since the inception of COVID testing at the FLET on March 10, and the dates are important here, the lab tested a total of 613 samples from 589 separate individuals from across Texas Public Health Region 4 and 5 North, with 44 positive cases identified and reported to public health. The vast majority of that testing during that time frame over 3 weeks between March 10 and April 1 represented the region's primary source of testing during that period. Since then, I am aware anecdotally that commercial sources of testing have picked up, such that the Texas Department of State Health Services reported on its website that as of April 10, in Smith County alone, that a total of 1,081 tests had been performed. Therefore, I have surmised that testing has at least continued at a roughly equivalent pace throughout the month of April. The community should also be aware that other forms of testing, symptomatic patients and other higher risk individuals, continue to come on board and to be validated. Some of these tests check for the virus, while others check for antibodies. In addition, some of these tests are performed on a more rapid testing platform. There's also an evolution of sample collection types and methods for the virus, such as from the nose or even saliva. Many of these are coming along, but despite these advances, resources remain limited for large-scale screening or surveillance types of testing at the present time. Now, as to the information that Mr. Roberts has presented regarding the notion of flattening the curve, it's difficult to reach conclusions with certainty, so I want to caution you as you look at this graph. However, based on this relatively short time frame and small number of positive tests, the information would suggest that the pace of growth and change in numbers of newly collected positive samples began to taper within days of beginning restrictive statewide and local social mitigation measures. Furthermore, over the last several days, there appears to be suggestion of a decline. Let me bring your attention first on this graph to what Mr. Roberts was referring to initially as the blue bars here. These represent the number of positive tests based upon the date they were collected, typically after the onset of symptoms. Next, I would point out the blue dashed curve at the top of the graph, which shows you the cumulative number of positive tests over time. What does that mean? That means that we simply add positive tests each day to the total count. So when you look to the far right of that curve, you will see that as of yesterday, April 15, we had 108 positive cases. Finally, and perhaps most importantly, I call your attention to the red-orange dotted line or curve. This one is a bit more complicated in that it represents an average 3-day % change over time. Now, without going into excess detail here, It's like a pace line, a pace car, showing how quickly the number of positive cases is going up or down. In other words, it shows speeding up or slowing down in the number of new positive cases. Thus, you can see that in mid-March, things were speeding up, while in late March and early April, the curve was flattening. Finally, over the last few days, there appears to have been a decline. A key point I would like to make has to do with the arrows you see in the graph, which represent some of the different restrictive measures and orders that have been put in place, mostly having the result of ensuring social distancing. In particular, I again bring your attention to the arrow on March the 27th in the middle of the graph when the Smith County stay-at-home order was put in place. You will see following this that there is a few-day period, roughly a week, before the pace line begins to drop off. This may well be explained by any exposures that occurred just before the order went into effect and the 2 to 14-day incubation period before people began to have symptoms, thereby resulting in a test collection. Though I again want to remain cautious about our interpreting this data based on an early time frame and small numbers, in short, the curve appears to be successfully flattening in response to the important social measures that have been put in place. As an aside, I want to mention that this method of analysis is similar to that recently utilized in a report from the Centers for Disease Control published this week on April 13th on a similar topic in multiple U.S. cities. So this is not a new technique. This is a technique that is being used widely in order to demonstrate this information to the public. And with that, I conclude my remarks.
Good afternoon. I'm Reverend Ralph Carraway of St. Louis Baptist Church, and thank you, Judge Moran, for the opportunity to come and share. These last few weeks have been quite a different approach for our spiritual communities, and Tyler, Smith County is a very spiritual community. But while we have been practicing social distancing, does not mean we need to be spiritually disconnected. And so I think one of the things that has happened for our communities, our churches have had a lot of opportunities to come up with other ways of worship. We want to stay connected spiritually, and I want to encourage us to do that. Small groups is a good way to do that, and thank God so much for technology. We can do that through Zoom and Facebook. I'm learning so much technology now through my grandchildren. It's an amazing thing how little you actually know. And so we want to do that. But also we want to protect those in our congregations that are vulnerable, our older members, and also those that have pre-existing health conditions. I think it's a great idea right now that we are doing live feeds and not coming together as assembling together. There's so much harm that can be done by that. So I want to encourage all of our fellow pastors and all our fellow parishioners, let's be very supportive, and let's be smart about protecting our community as a whole. Also, I think that we have a great opportunity to set an example following the mandate that has been given to us by our judge. You know, one of the things about faith-based communities, we talk about being disciples. Well, disciple means to be disciplined. And none of us really like a lot of things that are in place right now, but in order to keep our community healthy and to keep it strong, I think this is a great opportunity for us to do it as a whole. While being distanced, I think we have great opportunities to reach out and develop partnerships with all of our local communities. This is a great time for us to do a lot of evangelism by being able to go out and help our elderly, becoming those people that run errands for them, becoming those people that now can help them in ways that they can't do at this present time. And so I want to encourage our faith-based community that we will follow the directions of our Judge Moran and our state governor, and we continue to be a healthy, whole community. I think right now at this time, when we hear about the changes that are happening in the curve, we cannot by no means let up what we have in place. And so I want to encourage us, while we are practicing social distancing, but as a faith-based community, let's stay spiritually connected. And I want to encourage us to do that, and I believe that our faith will see us through this tough time. Judge, thank you so much.
Good afternoon, everyone. My name is Nancy Ariano Rangel. I'm the President and CEO of the Hispanic Business Alliance. I want to thank our amazing leadership that has been to this point providing a lot of information to our community. What I'm going to do is I'm going to reiterate this information in Spanish so that we can reach out to our Spanish-speaking community that lives and resides within our county and region. Hola, buenas tardes. Mi nombre es Nancy Ariano Rangel. Yo soy la presidenta de la Alianza de Negocios Hispanos aquí en Tyler, Texas. Nuestros líderes de nuestro condado y de nuestra ciudad de Tyler, aquí en el condado de Smith y la ciudad de Tyler, nos han proveído anteriormente información sobre nuestra comunidad aquí, en lo que está pasando con el COVID-19, que es el coronavirus 19. Déjeme comenzar con dejarles saber que nuestro juez del condado de Smith, Judge Nathaniel Moran, el juez Moran, ejecutó una orden el 27 de marzo en quedarse en casa. Estos son los pasos que cada negocio tiene que tomar y tiene que cumplir para que podamos nosotros incluir y hacer lo que tenemos que hacer con esta orden. También esta orden fue dada por nuestro gobernador estatal, también el 31 de marzo, y por igual el juez Morán, también en coordinación con las oficinas del distrito y de la ciudad de Tyler y la oficina del sheriff, también nos ha dejado saber que los términos han sido notados y escritas y hechas en públicas. También cuáles prácticas son aceptables para cumplir con esta orden local que es puesta por el condado aquí de Smith. Solo los negocios esenciales, el cual él ha hecho claramente y distinguido, ellos han proveído una lista sobre comparación sobre los negocios esenciales y los negocios que no son en este momento considerados esenciales. Queremos que ustedes tomen y miren esa información y que permitan, esta orden permite que continúen en operación algunos negocios, pero también tienen que continuar con las ordenanzas que están dando en esta orden de quedarse en casa. El juez Nathaniel Morán nos urge que sigamos estas órdenes y quiere que sepamos también a este momento que esta conformidad continuará, enfocarse más si los negocios no cumplen o siguen estas órdenes. Queremos que ustedes sepan que estas órdenes en este momento son muy importantes. Las circunstancias sobre el virus continúan a desarrollarse cada día, pero queremos que todos ustedes que nos están escuchando y que nos van a escuchar más después, que por favor tomen toda precaución posible y que sigan las órdenes que se han implementado no solamente localmente también, pero por el CDC. Hay que recordar siempre que la vida de nosotros es lo más importante en estos momentos. Como humanos es lo más importante. Queremos pediros a todos ustedes que hagan su parte, que sea un personal o sea profesional, que continúen la protección de la salud, también de la seguridad de todos de nosotros. Queremos que básicamente nuestra comunidad, la cual es nuestra comunidad, que a los cuales nosotros vivimos y servimos. Si ustedes tienen algunas preguntas o tienen algunas cuestiones, por favor, no temen en llamarnos o comunicarse con nosotros. Pueden comunicarse con la Alianza de Negocios Hispanos, también pueden comunicarse con el condado de Smith, la ciudad de Tyler y el departamento de Net Health. Todos ellos tienen información no solamente por la internet, pero también tienen información en las páginas de Facebook y otras relaciones sociales. Por favor, si tienen alguna pregunta, por favor no temen en ir ahí para obtener información y recursos. Muchas gracias por su atención y por su tiempo.
Thank you very much. My name is Martin Hines, and I did want to say again that this is I like to start out every time, this is our 30th day of operations of our Emergency Operations Command Center. Fire Chief David Coble and Jay Brooks with Smith County are our leaders in that organization, and I want to thank them so much for everything that they're doing. And also to the city of Tyler, again, still has 25 employees working alongside 25 employees or so of Smith County, which I think is very important as we continue this effort. And I really do want to thank Dr. Levine and George Roberts for really doing a deep dive today with those charts. I do think that is information that is not only beneficial to the command center, but also to the general public. So I want to thank y'all for that. And I do want to give a shout out. There's a person behind the scenes in their organization that you don't see really out front, but his name is Russell Hopkins. And he is part of our Emergency Command Center executive team with George and Dr. Levine, and his data is all throughout that information. And I want to thank him for everything that he's doing. And as Judge Moran alluded to, there is so much talk in the media, the national media, the state media, about how we reopen communities. And I would just like for you to know that the governor is going to be speaking tomorrow. We have no idea what he'll say, but he is apparently talking about that. Lieutenant Governor of the state of Texas has put together quite a vast organization, we understand. And then I believe that if you watch the national news, which I really try to watch the local news, but when I do watch the national news, I understand President Trump and that he has got a large organization on that as well. I think that I would like for you to know that we have several working groups in our Emergency Command Center that really have begun looking at those different components on what's best for our town, what's best for Smith County, what's best really for our area, especially given the numbers that we're looking at. You know, every time you watch the national media, right, it's all we hear about is New York. It's always New York. But I think what's so important is the local media and our command center and all that what we're doing is we're focusing right here on Tyler, Smith County. And so that will be very good information. And just I want you to know that we're working on that. But it's really important that all the stuff that the Northeast Texas Public Health really came to us with, and our only main thing that we could do to fight this disease was the social distancing, the washing of hands, and cleaning surfaces. And I don't know if you noticed me sitting back there. I'm wearing a cloth mask that was my sister-in-law mailed to me. I do think all these things are important. It's made a difference in the community. And it's not, I will tell you, I'm a firm believer that it's not any of us up here can tell you what to do or how to do it. It's each individual in our community that's taken a personal responsibility and wanted to make sure that we did not become a hotspot in the state of Texas or in this country. And I think your work and efforts have made a difference. I do want to just add a few other things. The TJC facility is up and running with the work of the EOC logistics team. TJC has volunteers. There's also a volunteer group called Hand Up Network. Please go to their website, handupnetwork.com, and please feel free to donate to them because they are an organization that is helping all of our first responders and healthcare workers. And also the program where we're actually providing meals to the ER departments and the people that are working so hard for us is really working well. And you can go to the East Texas Community Foundation to find the location to donate for that. But again, thank you so much as a community for everything that you're doing day in and day out to make a difference. Please know that we're really working hard at trying to stay 2 to 3 weeks ahead of this on every item. And so the next item is what you're allowing us to really to sit and plan about, because you've done so good at the social distancing and the other items that the Northeast Texas Health has pushed, and we've all pushed, that we're seeing the decline in the numbers. But we need, please don't be mistaken, we need to continue this for a little bit more time, because the worst thing for business, is for us to open back up and then have to go back through something like this. We don't ever want to do this again. So we want to finish out this appropriately. And the message from Ralph Carraway, I appreciate that just so much. The faith community has been incredible in this community and helping us. And so let's just stay steadfast. Let's work through this. We're almost done, but we have a little bit more time to stay strong with this. And so, again, thank you very much. And now we'll open it up to questions. And I've got the first question. I had an email or a text when I was back there. George, this was for you. How are you working along with the nursing homes and other homes in this community?
Sure. Thank you, Mayor. The nursing homes are a very important piece of our community. We have surveyed all the nursing, had the chance to survey all the nursing homes, make sure we have good contacts with them. But there's also been some nursing homes that have had their employees have gotten sick with COVID-19, or they've had there's a couple situations where their patients have gotten sick. We have personally spoken with each of those nursing homes, talked about them about the various steps that they're taking to protect their residents as well as their employees. I'm very pleased that the approaches that they're taking, they're being very upfront with it. They're also asking my organization what steps should they be, there's some extra things that they should be doing. So I'm very pleased right now with the response so far in our nursing homes. And that's something we want them to continue to be vigilant with their residents, but also with their employees to how they're handling that. So thank you very much.
George, this is probably a question for you or Dr. Levine. People, when it comes to that graph where we saw what you guys called the flattening of the curve, they're going to have some difficulty looking at that and understanding it. What should the big takeaways be from that data so far? Sure.
So let's put that graph back up there. There we go. So the big takeaway, I think Dr. Levine mentioned this even, that the first thing is you're starting to see the curve starting to go down. It's starting to flatten, and so that's a very good sign. Is it going to keep going that way? We sure hope so. We think that as you look at the graph there, the stay-at-home order was issued on the 27th. I think we saw that there was some spikes there a few days after that, but then we saw probably roughly a week and a half where the trend line starts to go down. Also important in there, Blake, is that you see the red numbers, the dates. The red numbers there, like 3/9, 3/16, those represent Mondays. And again, those are the dates. This particular graph it's not the date the samples were confirmed positive. These are actually the dates the samples were collected. So we think that's a very important thing too. Dr. Levine, if you want to add a few things to what
So one of the things I was trying to emphasize is this notion of pace, okay? And there are different ways to think about that, different curves to look at. But how things are sloped, how quickly they are rising or falling is really what we're interested in here. It's like being in your car, right? And think of the miles per hour as the number of cases, right? And so when you push your foot on the accelerator and you go up very quickly, obviously that's what that says is you're changing your pace of the spread of cases very quickly. What we want to do is we want to flatten that out. We want that pace to slow down because it represents how quickly things are spreading. And the more we can slow down the spread, the more likely we are to completely get rid of the cases altogether. And I don't know if that makes sense, but it's really a pace issue. How can we slow things down in order to get to a point where we're no longer spreading the disease?
And you mentioned earlier, obviously this is a short time frame, kind of big picture here. How far out would you actually have to be to look back at this data and recognize that the curve was in fact flattened and that there wasn't one point of peak?
Yeah, that's a really good question. So the numbers are small for us. 100 cases is not a huge number of cases in the grand scheme of things. The other thing that this particular graph tries to do is to partly address that issue by using a bit of a rolling average, okay, to see how things are going day to day in terms of that pace. I don't think there's an exact answer to know how long before the last few days where things have begun to decline. Is that just a little glitch in the process and it's going to jump right back up? I don't think we know the answer to that, but I think what the idea behind this is to show that it would appear that the things that have been done at least are related in time to the fact that things have slowed down and begun to drop off. So that is a signal, right? That's a signal that if we continue to try to do our best at what we've been doing, that hopefully we won't see an uptick or upsurge.
And I imagine when you put this together, you have to look at how many tests are being done a day compared to where we started. Is that being factored into this? When we talk about number of tests, are more being done now than ever? Or
yeah, that's without getting too confusing here, we would want to be careful not to mix apples and oranges, because total tests versus total positive tests and how you draw those on curves can mean some different sorts of things. That's not to say, if this is a point, right, that's not to say that we have uncovered all of the positive cases here because of the lack of testing. But based upon the evidence that we have, it would seem with this small group that the measures that were put in place seem to be suppressing, especially if you're continuing to test at the same rate, which is the point I was trying to make earlier, that there's no reason to believe we haven't been testing essentially at the same rate. So if we keep up at that same rate of testing, then something else must be related, it would seem, to the fact that the pace of positives is beginning to decline.
Thank you, Doctor. This is probably for George. In the other counties, I'm trying to expand beyond Smith County for the audience here, what we see on this mitigation chart, are we seeing this in the other counties that you guys do disease surveillance for, or is it varied?
Yeah, we haven't. So we haven't actually. This is the first county we've actually done this for, Blake. So I haven't seen the data to be able to answer your question properly. We do know that Gray County is seeing their numbers. I think they're up around 48 last time I saw. So their numbers are going up. I don't know how the testing numbers all compare, so I don't know quite the answer to that. Other smaller counties that we work with, they're seeing their numbers rise at a very slow number. So they get maybe 1 or 2 cases per day. But again, I need to do that, the same graph for these other counties first to be able to answer your question properly.
And you bring up, and you may not be able to answer this, but you bring up the rural counties. I know there's a few that I've been able to list here that have seen pretty significant growth in the number of cases, and that probably has to do with testing also. But that shows that maybe what we see here isn't necessarily the case for the whole area, right?
Right. Well, you can look at you can kind of go back to our heat map there, if you can pull it up, Judge. That's it. Yeah, you kind of see, I don't know if you can, right over here, I think you can still hear me. You kind of see our biggest concentrations of cases really are in the 75701 and 03 zip codes here in Tyler, and then the 75605, I think it is, in Longview as well. So those are the 3 biggest areas that we note out there. So the smaller, in the other counties, large geographic areas, they have a few cases, but again, I think our biggest concentration is right here in Tyler and Longview.
And for the first time today, we saw the demographic data for COVID-19 cases. Correct. From a health authority standpoint, looking at that, what does that tell you guys? What did you learn from that data?
Well, we looked at there's a fair amount of testing going on. We also realized that it's the demographics in a lot of ways kind of match up with what we see here locally. I think the Hispanic numbers were lower than I expected. they may not be getting tested or something like that. So the numbers kind of matched up with what we were anticipating.
Thank you.
Thank you. Yes, sir.
Hey, I'll start with you, George. So we've seen that quite a few employees of nursing homes have been tested positive. What about healthcare workers in the hospitals, EMTs, firefighters?
I know several healthcare workers, including the nursing homes, have been public with it. I know of several other situations where they have. I'm only aware of one case where it was actually work-related, off the top. Now, there may be some more, and that might be a question for, you might have to ask the hospitals to see how they answer that.
Okay, and then I've got a question for Dr. Levine. So last week during your update, the Public Health Lab had tested 582 people. That's up by 7 this week. Do we know how many people were tested privately from last week to this week? So we can kind of give a scale of the private tests going up.
We don't have a way to capture that information. We do understand that information from the commercial labs is required to be reported, but it is typically reported to the state level. So as we understand it, that's where the information that the Department of State Health Services, how they're capturing the information in terms of the increasing number of total tests per day and on a county basis. All that we're able to see is that breakdown that you can see in terms of the number of tests done in a particular county. So that's why I was trying to portray in the numbers earlier. In the first 3 weeks, there was really very little commercial testing going on. So those 500 to 600 tests over 3 weeks were about 200 tests per week. Since then, in the Flat Lab, we've done a nominal number of tests by comparison to those that have been going commercially. And what we're seeing with that number that I gave you, 1,081 as of the April 10th. For those last 2 weeks, that difference between 600 tests and 1,000 tests is about 200 tests being done per week in commercial labs. It's the only way that I can get to that number. So what it tells me is that we haven't really let off in the testing. We've kept about the same pace of testing. And so based upon the same level of testing, the number of positives that are coming out of there should not change dramatically, assuming we're also using the same criteria for testing.
That would follow up to that. So the state is now putting this on their website. I don't know if you've been able to find that. Have you been able to see by county the number of tests?
I haven't looked yet, no.
Okay, I'll show you how to, only laptop, I can't get it on my mobile. I was shown the other day how to find that, but they are now listing, I think they're updating it once a week. Basically, they have a total number of lab tests per county on their website. I think the last time it was updated was the 8th, so it's time for it. Hopefully it's going to be updated either today or tomorrow, but I can show you how to find that.
Okay, and then have we received any word on when we're going to see more of that drive-through testing and then maybe some of those rapid testing machines coming to the area?
I know Dr. Levine said that they've got an Abbott, one of the rapid test machines out at the Flat Lab right now, but I think the issue is that, correct me if I'm wrong, I think the issue is that we had the machine, but the reagents have kind of been an issue with that. And I'll let him respond to
that. We do have an Abbott unit. There's actually more than one Abbott unit here in the community. Again, it's a little bit the same issue. We have the testing platform, but we can't get the kits or reagent in any reliable supply sort of way. And so we have a very limited number right now on Abbott, and we've also, interestingly, had a little bit of a concern about the potential false negatives with some of those rapid testing units. And we've heard that there have been some interesting pieces of information that have come out about some of those in terms of how they're collected. For instance, if you take a swab and you put it into what's called viral media, does that reduce the concentration enough that when it goes into one of those testing units, it can't pick up the presence of the virus? So there are a lot of things going on in that regard. To get back to your exact question, there are some other platforms that are coming online here in Tyler that are more rapid in their nature. Most of those still are for purposes of measuring the virus through PCR. There is also, as I understand it, an antibody test that has come online, which is actually the only antibody test thus far for clinical purposes that has been approved by the FDA through an EUA, basically.
Corey, we'll show you that. Hi.
We have
first?
Yeah.
Okay.
Okay. We have been getting a lot of questions in terms of testing in prisons and jails, especially just countywide. Are the people inside there, are they being tested at all, and are they included in the current count?
So the current count is no. That's the Texas Department of Criminal Justice. They are the inmates in the you talk about the jails like in Palestine and places like that. For those, those are counted through the Texas Department of Criminal Justice, and we have not been involved with that. The local jails, that might be a question for. I'm not sure how that testing goes. I think the local jails, I think it's basically through the your normal systems.
Do you want to speak on that?
Sure.
There are no cases other than the one that's been reported from Gregg County. There are no cases in our jail, so I can report that as far as how we're concerned. I have visited with the other regional county judges on their prison systems in their counties. Of course, we don't have a state prison system here in Smith County, and they are not included. I can confirm that from what Mr. Roberts said. They are not included in their local count. So if a particular prisoner is in a prison in a different county but has a residence in Smith County, he's not included in the Smith County count. He's included in a separate count that's simply just a TDCJ count.
Okay.
Okay.
And also for you, I know you mentioned the word responsible restart. Do you guys have a timeline at all? I know we're waiting to hear what Governor Abbott says tomorrow, but do you have a hopeful timeline of when businesses will be able to reopen? Well, it is dependent on the governor and lieutenant governor and the president, and really what they decide to do on a national and state level. And we have discussed that at length in our EOC, and we're trying to be very cooperative in the way that we move forward with our state partners. And so we need to see what the governor does tomorrow and how he rolls out his plan and some of the other statewide initiatives. But I can tell you we're ready to put businesses back as soon as we can get out of this April time frame in a responsible manner. That doesn't mean that every restriction may go away. We're simply going to talk through that process once we hear what the governor has to say and the direction he wants to give. But we're hopeful that he gives local authority for us to do what's right for Smith County, because clearly Smith County behaves differently than other counties in the state. We, I think, have taken a very responsible approach to this on an individual basis. Individuals have grasped the seriousness of this and have taken it seriously throughout the last month, and we want them to do that even when the regulatory marks are lifted. Okay. And Reverend, I have a question for you, because I know, like you guys said, faith is very big here. What's your congregation doing? Because I know a lot of congregations across the county haven't been able to meet in person, and a lot of people are having to go on church online. How are you guys making sure that faith remains constant at your church? Well, we are doing live feeds on Sunday morning and then again during the week. But, you know, we're reaching out to one another, technology, Facebook. I'm learning how to Zoom. I'm learning a lot of things right now, and just a whole lot of different ways of reaching out, especially to our elder people, those that are vulnerable. We're trying to do things to keep them focused and keep them connected. I think that's really important right now to the psychological aspect of it. And so we'll learn how to do some new things. I think we've gotten used to always being in the building, so now we'll get some challenges. I saw a church in Longview that had a praise and worship service up on the roof. I doubt if I do that. He said, low I'm with you, not high, but low I'm with you. So I doubt if I do that, but we're looking at some innovative and creative things, yeah, to keep us connected. Okay.
Pastor, I want to ask you. Follow up there. I was trying to get here quick enough. Do you have any idea, as far as, I know you had addressed kind of the community spiritually, any idea how many churches have, how their attendance has increased online, or any, I guess you can talk for yourself, but any idea over Easter weekend what that number might have looked like combined?
I have talked to a few pastors, and I think that's the great thing about it. With the live feed, you do get a chance to have more viewers, and not only locally, but you get to connect with families that have families in different states, and so that's been a good thing. I think it's been productive. For those of us that are online, you do have a chance, but you also have a chance to read the view of what people are saying about your worship experiences. So that's been great for us and other pastors that I've talked with.
Very good, thank you. I'm not sure who to address this to. If Governor Abbott, Judge Murray, if Governor Abbott moves forward, I know we're talking about a 4-stage approach, and when we get to that point, how soon is Smith County planning on rolling it back up for business, rolling out for business?
Well, I think a lot of this is determined by the numbers as well, and our continued embracing of the social distancing. The numbers appear to be in a position where at the end of this month we can start loosening things up, and that's our hope. But there's a lot to responsibility on that for the community, because if these numbers continue to rise, we're going to have to continue to evaluate that. As Dr. Levine and George Roberts have both mentioned, those trends are very short duration of period of time, and so if we see those trends reverse or do something different that make us have to reevaluate this, we're going to continue to evaluate it on a day-to-day basis. We're hopeful, based on what we're seeing now, and if this trend continues, that by the end of this month, when the governor's order ends, we can start loosening some of those restrictions, a lot of those restrictions for businesses, so that we can begin to go back in a stepwise and responsible manner.
And care to talk about risk versus reward? I mean, I know that's a big question on a lot of people's mind of, trying to follow through with the order, but at the same time, I feel very pinched in this situation. What do you say to those folks?
I'm not sure that I follow your question. So,
well, the risk of, what if we come back too soon, but the reward is, hey, I saved my job or my business or that kind of thing, versus we may lose it all in that.
Absolutely. We are called upon as leaders to make very time-sensitive decisions with limited information oftentimes, and without the benefit of hindsight. That's just simply what we're called to do, and we're going to have to make some of those decisions. So on the backside of this, it'll be pretty easy to say some of those decisions were imperfect. I can already second guess some of the decisions that I've made along this process. Our hope is that we will continue to make reasoned and rational decisions that are weighing the consequences on both sides. We did that coming into this, and we're going to do that going out of this, because we knew coming into this, once we put restrictions in place, there was going to be economic impact and harm to individuals and businesses in this community, and that weighed heavy on me, my mind, my emotion, my spiritual being. It was against my nature to enter into those regulatory time periods. So when we exit out of this, there's going to be downsides. There's downsides really to both approaches, but we make calls like that all the time in government. We have to. Those are the hard calls. And a good example and analogy of that is driving a vehicle. I was talking about this with somebody this week about, we could, as a government, say you cannot drive a vehicle, and by doing so, we would save lives across the state, because there are accidents that cause lives in a vehicle every single day. So we could save those lives by saying without question no vehicles anymore. But we don't do that. We allow the driving of vehicles for what purpose? Because it serves a lot of purposes economically and otherwise in this world. But we know by doing that, unfortunately, we see on the backside of that, we know that there are going to be lives that are lost. We hope to find good medium points, like regulating the use of seat belts, speed limits, traffic signal devices, things that can bring reasoned and rational approaches to allowing the use of vehicles. And we're hopeful we can do the same thing in this time frame as well. But truth be told, the long-term benefits to this community will be driven by whether or not we make those individual hard choices to be disciplined and to be diligent in our healthy lives.
Thank you. Mayor Hines, I was going to ask you.
Yeah, I want to follow up a little bit on that. Well, go ahead and ask me what you want, and I'll follow up anyway.
What are the numbers looking like at TJC as far as healthcare folks, first responders taking?
It's really not a large number right now, okay? Because so many have already worked on their protocols with their families, and we've seen that. But it's definitely something that I believe that we as a community needed to offer to the local heroes and the people that are working so hard on the front line. I think that what we're seeing, and to the judge's point, look, when we started this, I mean, we had no idea. We saw these huge numbers starting to grow in this country, right? And as much as I'm not a fan of New York, but right, I mean, that's just horrible what happened to them. And I think that the good thing that I think we've learned is that, they're so compacted. I mean, you get in those subways, I mean, you're on top of everybody. And I think that we've learned that with us doing the social distancing that we have done, and we've proven that we can do it in this community, right? I think because we've already been separated enough, just because, I mean, we drive cars. We don't get in a subway, right? So we're already independent enough to have some distance. And then with the other measures that we've taken, I think have made a big deal when it comes to these numbers, right? And so what I'd like to really say is that, once we started this emergency operations command, that we've all been on the same page. I mean, it's not like your public health has been pulling one way, the county judge pulling another way, the mayor, and we've been all together on this, and we've really spent a lot of time making sure that we're analyzing everything properly. And I think the good news that we saw earlier from the health department is that what we've been doing is working, and the numbers are really not increasing. But as you know, 3 or 4 weeks ago, I mean, the entire country was in a panic. I think the greatest news for Tyler, Smith County, and really our region right now is don't panic. I mean, we've done great. We've done the social distancing. We've done the things that we need to do to impact the numbers. And then I think we've all learned so much. And I'm even starting to understand Dr. Levine, really, in some of the stuff he's saying, right? But I think we're learning that it has been in those areas that people are just on top of each other. 3 or 4 younger people living in a 500 square foot apartment in New York, right? I mean, they're just right on one another. I think that kind of issue, I think, has turned out to be the biggest. But I think here we've done all the right steps. And so the main thing is, if we can just do it just a little bit longer, find out what the governor has to say, the lieutenant governor, I think that's actually going to be more important than the president's going to be talking about different regions of the country. But this is our region. And I'm very hopeful. It's not like the governor's called and asked my opinion, but I'm very hopeful that what he'll do is say, look, East Texas has done a great job at doing what they do. And that's pulling together with their own resources and commitments. And that we ought to be able to figure out our own framework coming out of this. But I just think the message is a very positive one today that, I don't want people to be fearful anymore. I don't think we should be fearful. I think we should be more proud that we've done the right thing and we've gotten here. And I think I said at the last, I don't know whenever I said it, but look, I'm so glad. I believe that we've overplanned, but we've all been praying for the best, but it's better to be overplanned and know our community could do this, and we pretty much have to have done it by ourselves. Look, there's been question on testing, and you know, I see this on the national media. You know, we got to have all this testing, or we're not going to be. We never got the test here. We just never got the test, and we're not going to sit around and we're not going to whine about it. What we're going to do is we're going to look at our numbers, and then we're going to make decisions on our own how we come out of this thing. So I hope the governor gives us that tool in our toolbox so we can move forward. So, thank you.
I just want to make a comment. Thank you all very much, because I know you are all working tirelessly. So
Thank you all. Thank you.
Okay, right now, if you're just joining us, Smith County and Tyler officials giving an update on the spread of COVID-19 in our area. A couple of notes here. We'll show you some graphics they talked about, and also I'll give you some of the high spots this afternoon. The county judge of Smith County, Nate Moran, also talked about keeping on with discipline. Cases of COVID-19 are going down, but they're worried about a resurgence there. Keep making those healthy choices like social distancing, and also wash your hands a whole lot. He also spoke about a responsible restart. I'm going to get to that in a couple of moments. First of all, waiting to see what Governor Abbott's going to say about this on the state level for Friday. Smith County basically has a restart plan, they say, for next week. We're talking about continuing good habits, but also lifting businesses that have been suspended, getting back going, also phasing out stay at home. George Robertson of Neth Health talked about 112 Smith County cases, including 4 new cases today. 47 people are recovering. That's good news. Also, 51 patients in East Texas hospitals with COVID-19. Those numbers are very, very good. Also, the curve is flattening, he says. That's better. They mentioned that zip code map that all media has been showing you. And once again, it just reiterates around East Texas, most of the COVID-19 cases taking place in the most populated areas. And we've been harping on that. Also, most people who end up getting the COVID-19 have already had serious health trouble. We're talking about people who smoke, people who are obese. Also, 60% of those are white, 26% of those are black, 3 Hispanic, and the rest are Asian. Once again, heavy smoking has been a problem there with people that had COVID-19. Dr. Jeff Levine, the county doctor, was talking about the testing is going well, 44 positive cases, and the pace of growth basically started to taper off once Smith County and the area started to use social distancing and staying at home. That's what they're touting for that. Then the Reverend Ralph Caraway, who is the St. Louis Baptist Church pastor, make sure I got his name right there. Yes, Mr. Caraway. Very nice guy there, talking about stay spiritual, but don't lose contact with other believers. Nancy Rangel, who's also the president of the Hispanic Business Alliance, also gave all the high notes in Spanish, which is a good idea to do. So, once again, Martin Hines, then the Tyler mayor, had a few things to say, talking about the task force that they put together, still is together, answering Tyler citizens' questions, also mentioning that the governor speaks on Friday. Now, let's talk about that, because they're saying they don't know what the governor or lieutenant governor is going to be talking about, but there has to be a reason why they gave a news conference to get ahead of the thing this Thursday afternoon. That's just my speculation there, and they're trying to be ready, because that's going to be a heck of a news conference tomorrow when that happens. So once again, media questions, the only one worth really repeating. Once again, George Roberts was saying with nursing homes, they have been very involved in nursing homes and making sure that all the protocols are followed there. So that has been the end of today's news conference, but again, tomorrow, Greg Abbott is going to be speaking to us. I don't know what time that news conference is going to be happening, but it's going to be a good one. It's going to be a very interesting one as far as news is concerned. We still have, we, the public, or I should say the media, have no idea what it's going to be about. But the way this is all looking, it looks as though they're going to start heading out of what we're doing now and maybe start to reopen Texas. Start to reopen. That's the speculation. Okay, that is the end of our coverage right now. And now back to regular scheduled programming.